Hi, I'm Selena, one of the pancreatic specialist dietitian. Patients come to see me because they struggle to eat due to pancreatic cancer or after a pancreatic surgery such as a Whipple's procedure.
I'm Kylie and I'm a dietitian working in private practice in New Zealand. People come to see me before pancreatic surgery when they're wanting to optimise their nutrition and perhaps start on Creon. Other times people come to see me after surgery, such as a Whipple's or a total pancreatectomy, wanting support with their diet but also optimising their dose and timing of Creon.
Let's talk everything PEI, or pancreatic exocrine insufficiency. Pancreatic exocrine insufficiency is a condition that occurs when your pancreas is not able to create the number and the volume of enzymes required to break down your food.
PEI, or pancreatic exocrine insufficiency, is more common than you might think. People that have had pancreatitis or pancreatic cancer or pancreatic surgery, all of these people are at risk of developing pancreatic exocrine insufficiency.
So the common sort of symptoms we would find for someone with PEI is a change in their bowel motions. And what you'll notice is that your healthcare professional will probably start asking a whole load of questions about how your bowels are working. In PEI, we would normally see a lighter coloured stool. It will generally float, it can be sticky, and it can be really hard to flush. So these are really important questions for us to understand what's happening within your bowel and your pancreas. Your doctor may also ask you to do some special tests, like a fecal elastase test or a fecal fat test to determine whether or not the PEI is present.
Pancreatic Enzyme Replacement Therapy is the only treatment for PEI. It helps to break down the food so that your body could digest and absorbs the nutrients.
If you're found to have pancreatic exocrine insufficiency, the treatment is quite easy. It's about taking a special type of capsule called PERT, or Pancreatic Enzyme Replacement Therapy. When you're taking PERT, you'll have a little capsule that has little tiny beads all in it, which you'll take with your food.
In New Zealand, dietitians can prescribe PERT, which is great because we work so closely with people's food and nutrition intake.
Dietitians are an excellent resource for patients with pancreatic cancer. We help to provide the guidance in your food choices and how to take the pancreatic enzymes correctly. Each patient will take their pancreatic enzymes differently according to their food choices, meal pattern, and meal duration.
Usually I start with 1 to 2 Creon 25,000 for snacks and 3 to 4 with meals. But the key really is careful education and working with the individual in front of you to see how they eat and when they eat, and making sure they feel really confident about dose adjusting their own Creon depending on what they're eating.
The way you'll know if your PERT is working, if you're having enough, is that your bowel motion should go back to normal or close to normal as possible. So within 1 to 2 days, you should find that your bowels have regulated, and within 1 to 2 weeks, you'll start to feel a little bit stronger, and that weight that you're losing or having trouble maintaining should start to stabilise.
Pancreatic enzyme replacement therapy really make a difference in our patients with PEI. It helps to improve their quality of life through improved gut symptoms, subsequently improving in their food intake and their nutritional status. And because of the improved nutritional status, it also improves their survival.
PERT absolutely makes a difference, and it makes sense, right? Untreated PEI can make life miserable. You're constantly worried about what you're eating and where the nearest bathroom is, and is this meal going to cause pain, etc. With the right dose of PERT, people can regain their confidence with what they're eating, regain their energy, and live life fully again.
If you have any questions in regards to how your pancreas is working or whether your pancreatic enzymes will be useful for you, please reach out and speak to your dietitian or to your doctor or your medical professional for further advice.